Hi, I'm Patricia Nicole Henato. I'm a student, graduating student in Central Escolar University, Manila, taking up Doctor of Optometry, and I am 21 years old from Mandaluyong City. So nakilala ko si Doc through my friends and of course sa YouTube channel ni Doc. And nakita ko talaga yung procedures niya, yung treatments niya sa patients niya, super ganda. And nirecommend din siya sa akin ng friends ko kasi nakita ko yung procedure na ginawa ni Doc sa kanila and nagustuhan ko. Yung insecurity ko talaga matagal na is yung nose ko. Pero takot ako sa surgery and then nalaman ko tong procedure na to na painless and non-surgical, and after agad ng procedure, like super quick lang, makikita mo na agad yung result, and dun ako natuwa, dun ako na-excite about it. So don't forget to hit the subscribe button and the notification bell to keep you posted.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we will introduce to you another technique for the so-called non-surgical nose tip projection. But before that, let's welcome our 21-year-old female guest from Mandaluyong. Okay, so folks, let's welcome Miss Patricia Nicole, or I will call her Nicole.
Hi po, I'm Patricia Nicole Henato, 21 years old from Mandaluyong City.
Yeah, Mandaluyong, medyo malayo.
Opo, Doc,
Okay,
pero
welcome.
worth it.
Yeah, welcome to CSA. So looking at Nicole, okay, I was assessing her nose a while ago, starting from the radix part, yung deepest portion ng ating nose, which is this one, or the root of the nose. So at the side view, there's this somehow a little bit inadequate or inadequacy of the height. So minimal lang, Nicole. Okay, and then the nasofrontal angle, so somehow it doesn't meet the ideal, mga around 130 degrees. Okay, then looking at the nasal tip, so Asian nose, as we always describe our Filipino nose, somehow rounded, okay? And then for the case of Nicole, I was looking at the columella. Now, the columella is hidden. And then on the alars, somehow it's a little bit hanging, okay? So we have different types of nose features. Some have this, the columella is the one that's hanging, and the alars are the ones that are receded, okay? Some naman have too much of the columella, or longer or shorter. So those are nose features. So hindi tayo pare-pareho ng ating anatomy ng nose. So for Nicole, we wanted to improve the radix height. We wanted to minimize the roundedness of the nasal tip. We wanted to show the columella, upturn the tip, rotate it to a better angle, like around 100 to 105 degrees. And somehow, the alars also, because she mentioned to me when she smiles, it flares. So we wanted to narrow it, reduce that flaring. So, Nicole, nabanggit mo sa akin kanina, concern mo nga yung nose mo, insecurity.
Yes po, Doc. Like sa pictures po, pag hindi po nagsismile, okay lang po siya. Pero pag nag-smile na ako, parang yun doon na po lumalabas na rounded talaga yung nose ko. Mas nag-widen po siya. And hindi po maganda tingnan sa pictures and videos.
So that one, the alar flaring, is due to those muscle dilators. Yung nagda-dilate, nag-widen na nung nostrils natin or yung alars or sides of the nose. So, lalo ngang nagiging prominent yung pagka-rounded tip and yung medyo downturn yung ating nasal tip. So, with that, of course, we wanted to also treat yung muscle na yon. And at the same time, yung muscle dun sa gitna dito sa lower part ng columella, yung tinatawag na depressor muscle, yun yung humihila ng muscle natin or yung tip natin downwards. Kaya parang pag tumawa ka, mas bumabagsak pa. So, we wanted also to treat that muscle, okay? So, excited ako sa procedure ni Nicole. And considering we're introducing a new technique for the non-surgical nose enhancement to further enhance, to project the nasal tip, to beautify further. Actually, she's already beautiful. So, ating abangan ang actual procedure sa pagbabalik ng CSA Medical Aesthetics. And we're back. So, we'll now show the new technique that we'll be doing for Nicole. Okay. So, we'll start with the numbing of the area. So, I'll have an entry point at the infantip region here. So, for my entry point here. And then, a second entry point will be the tip defining point. And my third entry point will be in the mid-dorsum area. Here. Okay, so this is a so-called Haiku three-way technique. Okay, so we'll make a puncture point on those entry points. So a tiny puncture here using a gauge 19 needle, and then I have my Haiku PDO thread here. Okay, inserting my first thread. And then we'll proceed to the second. Okay. Third. Okay, some pressure there. Fourth. So the anatomical plane that I'm in, usually I use a space there between the deep fatty tissue and the periosteum and perichondrium. So this is the, how many thread? That was the fifth, then the sixth. So sometimes I use just 6 to 8, sometimes I use 8 to 10, so depending on the need to achieve that ideal height of the nose or that nasofrontal angle. So some resistance there. Okay. Then this is 8. Okay. So we can go with the 8 threads. Okay. And our second entry point will be at the so-called tip defining point here. Then I'll be using Haiku short thread here. So I grasp the columella so I can feel for the cannula entering. Okay. Then another Haiku short. So we wanted to make the columella come out. We wanted to project it, lift it, upturn it, rotate it to about 100 degrees. Okay. So some resistance there. Okay, inhale, exhale. I want to reach the anterior nasal spine. Here. Okay, there you go. Okay, so for our third entry point, it's in the mid-dorsum. So I'll inject with the lidocaine epinephrine for that third entry point, so it doesn't bleed that much. we add something with epinephrine for vasoconstriction. And then an entry point here. And then I'll use a short Haiku thread. And then insert. And then just glide towards the nasal tip. So it's expected to have some resistance here because of those thick tissues we have on our distal third of the nose. So mostly Asians or Filipinos have a thicker nasal tissue or volume. So all the way to that nasal tip, all the way. And then pull out. So another one. So this is our third entry point. So-called three-way technique. So glide towards that nasal tip. So some resistance because of the thick tissues in the distal third. Expect some bleeding here, and this will be our final thread for that. Okay, so we have done the so-called Haiku three-way technique. We'll show the result to Nicole when CSA Medical Aesthetics return. Back mga ka-CSA, so we'll show the result to Nicole. So Nicole, ito na ang ating mahiwagang salamin. Look at the nose enhancement result.
Ang ganda!
Right, yeah. So what we did for Nicole was we did a radix projection, increase the height, and then also nasal tip projection, and somehow bring out the columella. And on the base of the columella, we somehow give a filler. Actually, I added a little bit of a filler here just to further upturn the nasal tip and improve the nasolabial angle. And also, we added alar Botox. We injected Botox to reduce the alar flaring. Usually, the Botox, we see the result in 2 weeks' time. So, Nicole, what is your comment?
Naiyak ako daw. So, umiyak. Ang ganda.
Yes.
Super.
Right. Yeah.
And for me na sobrang low tolerance ko sa pain, doc.
Yeah.
Like, wala po talaga akong naramdaman na pain. Sobrang ang smooth ng procedure talaga.
Right. Yeah. So right now, what we see lang dun sa dorsum was the white blanching from the lidocaine injection. So kanina kasi we did injections of the lidocaine for Nicole not to feel the actual Haiku procedure. So this is a Haiku three-way technique for non-surgical nose enhancement. And then we applied yung mga tiny duoderm just to cover the entry points. Okay? Although Nicole was a bit of a bleeder dun sa mga entry points. Okay, so we still see some tiny or minimal bleeding lang dun sa injection point. So after this, we give post-care, yung mga home instructions, what to avoid, what to do at home. And then there are cases we follow up a week or 2 weeks later just to see again how the effect is. Especially with those we did alar Botox just to check if the amount of the Botox we injected was already enough. Ayan. Thank you so much, Nicole.
Thank you so much,
Yeah.
Super
Right.
happy.
Yeah.
Excited.
So the good thing, it was a procedure that Nicole was able to tolerate. Okay. By the way, I want to add lang because there are others asking me, what is the difference daw since we are using mga Haiku threads? What's the difference between PDO and PCL? PDO is polydioxanone and PCL polycaprolactone. They are both absorbable suture threads, and they are being used in surgery for quite a long time. So, pareho sila dun sa mga suture threads na ginagamit sa surgery na naa-absorb sila. Okay? Now, ang pinaka-difference is yung hanggang kailan sila naglalast. Okay? So, sino yung nauunang na-absorb? Actually, mas nauunang na-absorb si polydioxanone kaysa kay polycaprolactone. So, si polycaprolactone, mas matagal yung stay niya sa tissues natin. So, yung hydrolysis or that's the disintegration ng material, doon sila nagkakaiba. So, mas mahaba, mas matagal si polycaprolactone. And dahil mas mahaba, mas matagal, mas mahal. So, syempre, yung duration niya mas matagal. So, medyo mas mahal lang po si polycaprolactone. And in terms of yung feature ng thread, mas medyo flexible. Mas flexible si polycaprolactone, si PDO, medyo mas firm yung thread niya. So, somehow, mas nafe-feel mo yung polydioxanone sa nose tissues mo kaysa kay polycaprolactone. So, yun po, yung difference nila. I think we had an episode that we also mentioned yung presyo ng mga threads. And I also want to add, again po, the only professionals who are licensed to perform procedures like this are licensed aesthetic physicians or aesthetic doctors. Licensed MDs lang po in the Philippines ang talaga pong may mga or qualified to perform mga injections sa face, sa ilong, sa lips, sa buong katawan. Ang talagang licensed to perform lang po ng mga ganitong procedures are licensed medical doctors. Again po, yung mga nakikita nyo po na hindi doktor na nagpe-perform ng ganito, that is illegal practice of medicine in the Philippine setting po. Okay, ito po'y para din po sa proteksyon ng bawat isa to avoid or prevent complications. Kasi kahit ano pong klase ng mga procedures na may kasamang pag-inject, pagturok, lalo na po sa mukha, lalo na sa ilong, the danger zone. So, meron pa ring mga risks ang mga ganitong mga procedures, kaya magtungo lamang po kayo sa mga licensed medical doctors, specifically aesthetic doctors. Okay, so thank you, Nicole.
Thank you so much, Doc.
Thank you for being with us. And sa inyo po, maraming salamat. Kung meron po silang katanungan, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong, Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. We also have our FB page, CSA Derm Centre or CSA Medical Aesthetics, as well as Instagram, CSA Derm Centre or CSA Medical Aesthetics. Nicole, meron ka bang Instagram or FB? So they can follow you and may ask you or check on you kung kamusta naman yung resulta.
Sige po, you can follow me on my Instagram at Patricia Henato. My Patricia is spelled S-H-A. So you can follow me and I will post my result after maybe a week.
And wag po nilang kaligtaan na panoorin ang aming ibang mga videos or ibang mga episodes. So sa YouTube channel, type lang po Contessa Salvador and paki-like and subscribe na rin po. Okay? So God bless you, Nicole. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.